Welcome back to LMHS Live. We're here with another member who has shown up to the Diversity Summit this morning, and we're delighted to have him on the show. Let's get his name and the name of his company and get hit and some comments there. First of all, let's get your name of your company and why you thought it was important to show up this morning.
Sure. My name is Adam Bohras. I'm the CEO of ICNet Systems. We're a global company, the leader in patient safety and infection surveillance software. We're in daily use at over 1,200 hospitals, and I support a lot of diversity events. In fact, we support a lot of the events in the Chicago area, which is where I'm based, including the Nazi events and a lot of the Chef events, which is the Chicago chapter of the American College of Healthcare Executives.
Make sure we get a website or contact information for our many viewers who might be watching you before we get farther.
Sure. If you'd like to learn more about us, it's icnetsystems.com, and we also have a LinkedIn page, so you can look us up there as well.
Okay. You say you attend a lot of these conferences. So far, how do you see this summit stacks up against others that you've attended around the country?
Well, I mean, we just had the keynote speaker, and he was absolutely marvelous. I think, I think the whole healthcare system. I'm also a board of trustee for a hospital in Chicago, and we face the challenges of patients with diverse backgrounds, with difficulties communicating and translating when they're getting their care. And, the epidemic of obesity and diabetes is prevalent in our hospital as well. So it's a huge challenge and much underappreciated. So I think the presentation was outstanding.
So would you say that those things that you just outlined are on the front burner of most healthcare systems around the country, and people need to be aware of that and get engaged in the process?
Absolutely. I think people need to, look around and see what's going on in their own communities, and the whole concept of population health is really driven by leading healthier lifestyles, preventing all the influx of people coming into the emergency room with constant chronic illness. So we are investing quite a bit in changing the paradigm of how we deliver health care, how we transfer patients into their homes. It's very important. Plus, on the software side, our company is really focused on preventing harm. So having the ability to monitor patient symptoms, their comorbidities, and all of their blood chemistries in real time and react before the patient gets seriously ill or is having an adverse drug event or before they can spread infection. So prevention is still the #1 way to lower the cost of health care.
Finally, what do you hope that people will take away from today's summit?
I think a better appreciation of not only the problems and challenges we're all facing as we move to different payment models and redesign our healthcare system from the ground up, but also how diversity can help in those challenges.
Well, thanks for joining us this morning on LMHS Live.
Thank you very much. Appreciate the opportunity.
We'll be right back.